Complication of insomnia: psychological, low performance, low reaction time, risk of depression, risk of anxiety disorder, poor immune system function, overweight or obesity, high blood pressure, risk of heart disease, and risk of diabetes. Insomnia, also known as sleeplessness, is a sleep disorder in which people have trouble sleeping. Can occur independently or as a result of another problem. Symptoms of insomnia: difficulty falling asleep, including difficulty finding a comfortable sleeping position. Like me, I am also like that sometimes. Waking during the night, being unable to return to sleep and waking up early. Not able to focus on daily tasks, difficulty in remembering. So if you experience that, it's a sign of insomnia. Daytime sleepiness, irritability, depression, or anxiety is a symptoms of insomnia. Feeling tired or having low energy during the day is a symptoms of insomnia. Trouble concentrating is a symptoms of insomnia. Like we do some things we cannot concentrate. It's also happening to me. I think every one of us is experiencing that. Although not all the time we have trouble concentrating. Being irritable, acting aggressive, or impulsive. So what are the causes or associated with sleep breathing disorders such as sleep apnea or upper airway resistance syndrome? So if you have this, so that is the cause of insomnia because we cannot sleep. The use of psychoactive drugs such as stimulants, including certain medication, herbs, caffeine, nicotine, etc., or excessive alcohol intake. That's also the causes of insomnia. If I drink a lot of coffee, I cannot sleep. So that is the causes of insomnia as well. The use of withdrawal from alcohol and other sedatives such anti-anxiety and sleep drugs like benzodiazipines. The use or withdrawal from pain relievers such as opioids. Heart disease, that's also causes. Restless leg syndrome, which can cause sleep onset insomnia due to the discomforting sensations felt and the need to move the legs or other body parts to relieve these sensations. That is the causes also. Periodic limb movement disorder, which occurs during sleep and can cause arousals of which the sleeper is unaware. Pain and injury or condition that causes pain can preclude an individual from finding a comfortable position in which to fall asleep and can in addition cause awakening. Hormones such as those that precede menstruation and those during menopause. So if you are on the way to menopause, that is associated with insomnia if you have it. Life events such as fear, stress, anxiety, emotional or mental tension, work problems, financial stress, birth of a child, and bereavement. I think we all experience this. If we have stress, anxiety, emotional, then it's difficult to sleep. So that is insomnia. That is the causes also. Gastrointestinal issues such as heartburn, or constipation. So that is the causes of insomnia as well. Mental disorders such as bipolar disorder, clinical depression, generalized anxiety disorder, post-traumatic stress disorder, schizophrenia, obsessive-compulsive disorder, dementia, and ADHD. Disturbance of circadian rhythm such as shift work and jet lag can cause an inability to sleep at some times of the day. Certain neurological disorders, brain lesions, or history of traumatic brain injury. Medical conditions such as hyperthyroidism. So if you have hyperthyroidism, that is the causes also of insomnia. That's why you cannot sleep right away. Abuse of over-the-counter or prescription sleep aid, sedative, or depressant drugs can produce rebound insomnia. So be aware. Do not abuse the over-the-counter of prescription sleep. Poor sleep hygiene, example noise or overconsumption of caffeine. Physical exercise. Exercise-induced insomnia is common in athletes in the form of prolonged sleep onset latency. Increased exposure to the blue light from artificial sources such as phones or computers. So be aware because we always use phones or computers, but most of the times our phones is always in our side, so it's not good if we always exposed to that. Chronic pain, lower back pain, and asthma is also causes of insomnia. Risk factors. Insomnia affects people of all age groups, but people in the following groups have a higher chance of acquiring insomnia. Individual older than 60. History of mental health disorder including depression, etc., emotional stress, working late night shifts, that is the risk factors also. Traveling through different time zones, having chronic disease such as diabetes, kidney disease, lung disease, Alzheimer's or heart disease, that is the risk factors of insomnia. Alcohol or drug use disorders, gastrointestinal reflux disease, heavy smoking, and work stress is one of the risk factors of insomnia. Prevention and treatment of insomnia may require a combination of cognitive behavioral therapy, medication, and lifestyle changes. Among lifestyle practices, going to sleep early and waking up same time each day can create a steady pattern which may help to prevent insomnia. Avoidance of vigorous exercise and caffeinated drinks a few hours before going to sleep is recommended, while exercise early in the day may be beneficial. That is one of the prevention. Avoiding or limiting naps, treating pain at bedtime, avoiding large meals, beverages, alcohol, and nicotine before bedtime, finding soothing ways to relax into sleep. Making the bedroom suitable for sleep by keeping it dark, cool, and free of devices such as clocks, a cell phone or television. Maintain regular exercise. Try relaxing activities before sleeping. Stop checking the time. Management. Vary the condition if you are sick that cause insomnia. Medication has been used mainly to reduce symptoms in insomnia of short duration, non-medication based sleep hygiene, cognitive behavioral therapy. But the best thing that you can do is visit to the doctor because there are a lot of causes of insomnia. Medications, sleeping tablets, but only the doctor can prescribe it. Other sedatives, antihistamines, you can buy it over the counter, but for a short time. It's not good if you always take antihistamines. I also take paracetamol if ever I cannot sleep well, especially if I'm having a headache, especially if I reach 12 o'clock in the evening and still I cannot sleep. I have a big problem for that. So what I did is I take paracetamol. It can help a lot, but do not rely too much also on paracetamol. Try to sleep early as possible as you can.